Hello there, a good evening to you all, and thank you very much for joining us here on Rwanda Television News. We are glad to have your company tonight, coming to you straight from the heart of Africa, Kigali, and my name is Martina Abera. Let us kick things off by informing you that members of the electoral councils in the provinces and the city of Kigali have expressed their expectations from the Senate candidates, emphasizing the importance of advocating for the development of the people. The National Electoral Commission has also called on the Senate candidates to adhere strictly to the rules and regulations governing the electoral and campaign process. We have this report courtesy of Adam Squizera.
On Tuesday, Senate candidates began their campaigns by presenting their manifestos to the electoral councils across all provinces of the country, as well as in the city of Kigali. The Senate candidates in their manifestos have generally emphasized how they plan to implement the responsibilities of the Senate of Rwanda. They specifically highlighted that, if elected, they would work to enhance the functioning of the Senate and various government institutions, whereas their focus will be on monitoring government activities to ensure that leadership remains centered on the citizens' needs and that sectors like agriculture receive the attention and support necessary continued development. Members of the electoral councils in the provinces and the city of Kigali have expressed their expectations from the Senate candidates, emphasizing the importance of advocating for the development of people.
What we expect from the senators is their close engagement with us, particularly in Bugesera district. We want them to be actively involved in all political agendas, especially in helping us achieve development and good governance. We need to see them engaging with citizens at their national level.
dukurikije ibyo batugejeho tukaba dufite icyizere yuko tuzabona byinshi mu iterambere tuzagera.
Based on their manifestos, we have high expectations. We want them to accelerate the progress our country has made under the leadership of the head of state. If they align with this development momentum, we can achieve many goals, including improving essential infrastructure in our districts.
Tuzarigeraho kandi mu buryo bworoshye. Ni ibikorwa remezo dukenera mu turere.
They all clearly presented their ideas and everyone had the opportunity to showcase the innovations they plan to implement if elected.
Firstly, they should focus on the economy, addressing the issue of teenage pregnancy in our province and promoting development and job creation for the youth. The chairperson of the National Electoral Commission, Odaga Sinzigwa, has also called on the Senate candidates to adhere strictly to the rules and regulations governing the electoral and campaign process.
For the candidates, what is important is to follow the rules and regulations, to avoid anything which might bring unnecessary problems to them, and also confusion maybe to the voters, because we need to avoid all those things which are not allowed as per our guidelines, and we have shared them our guidelines. But mainly is to continue focusing on the unity of Rwanda, make sure that there are no any hate speeches during their campaign, make sure that we don't they don't give bribe to their voters. So those are the usual things we continue to explain to them so that they can follow the rules and regulations.
The National Electoral Commission (NEC) has announced the schedule for the senatorial election campaigns, which began on Monday, August 26th to September 13th, whereas the elections are scheduled on 16th to 17th of September 2024. Adam Squizera, RwandaTV News.
Thank you, Adams, for that report. The Ministry of Education is asking the heads of schools to avoid any kind of fraud, such as placing students in Senior 1 and Senior 4 without authorization from NESA. This was reiterated on Tuesday when the results of the national exams for primary and secondary schools were announced. The report comes from Enora Gladys.
The total number of students who took the exam for the 2023-2024 school year in primary schools was 200,000. Among them, 195,463 passed the exam, with a percentage of 96.8% and 6,492, equal to 3.2% failed. In the public high school of ordinary level, more than 143,000 students took the national exams, of which 134,245 passed 93.8%, while another 8,912 failed with a percentage of 6.2%. When he officially announced these scores, the Minister of Education, Twagirayezu Gaspard, pointed out that there were subjects that the students succeeded in, including mathematics and English in primary schools, and the subject of intelligence and participation in the general grade. Here he asked the leaders to increase their efforts in teaching these subjects.
Abanyeshuri bakoze neza mu masomo atandukanye, gusa nyine biragaragara ko hakiri imbaraga nyinshi zikenewe gushyirwa.
We see that in general students have performed well in different subjects. However, it is also relevant that we still need a lot of effort to be put in subjects like mathematics and English. In secondary schools, in ordinary level, when we see generally the results, we also find that subjects that students perform well, but some subjects like physics, as well as others in primary schools, to do with sciences such as biology, chemistry and mathematics, we have noted that a lot more effort needs to be directed towards them, which means that when we are giving these exams, we are also rating ourselves to see where we should put more efforts next time.
Hashyirwa imbaraga, ibyakozwe neza tukabyongeramo imbaraga, ariko n'ibitarakozwe neza tukabikosora twese.
Of the 195,463 students who passed the primary school exams, only 14,957 were given places in boarding schools, while the remaining 180,425 will be day scholars. The minister explained that this is part of the government's effort to support schools brought closer to the people.
Gahunda yo kwegereza amashuri abanyeshuri, murabyibuka ko mu mwaka w'ibihumbi.
Our education sector is growing. Students are increasing in our schools, which is related with education programs that we have, and there is a program of putting schools near students. You remember that during the lockdown, the number of schools and classrooms were increased, which means that local communities have more schools in them, and so the number of students has also increased. So regarding the students in boarding schools, we first have to analyze the available space and then allocate students according to their performance. This year, we try to improve that procedure to avoid overcrowding in boarding schools. And so we also want to focus our efforts on day schools because we have noted that that too is improving.
Cyangwa se nabo nabajya muri day schools babi bakwiga neza.
After the release of these results, the Ministry of Education asked the leaders of the institutions to avoid the mistake of giving seats to students who were not given by the government.
Mwaka wa kane ndetse no mu mwaka wa mbere abanyeshuri bajyamo n'abanyeshuri bashyizwemo na NESA.
Another thing that we want to remind you concerning the students going to Senior 1 and Senior 4. Such students are sent to schools by NESA, which means that there are no head teachers or teachers allowed to put a student in a place either in Senior 1 or Senior 4. In cases that students need transfers, then an appeal can be made to NESA, and so parents cannot use head teachers or try calling the ministry directly. That is not how it works. We urge you to therefore be transparent in the way students are placed in relation to their performance as well as their choices, but using the established system.
Dukurikije uko bakoze ndetse n'uko basabye, bisaba ko tubikorera muri systeme yabigenewe.
Rwandan and Congolese nationals engaged in cross-border trade between towns of Rubavu and Goma have said they are being careful to protect themselves from the Mpox virus and have commended the measures in place at the border to fight the spread of the disease that include washing of hands and temperature checks for people crossing between the two countries. It has been noted, however, that not all local residents in the area have sufficient information on the virus or even how it spreads, despite efforts by both Rwanda and the DRC to educate communities on the dangers it poses. Health officials at Gisenyi Hospital have confirmed that cases of Mpox have been on the rise in the South Kivu province across the border, hence the reason stringent preventive measures are in effect for people using the crossing point with medical provisions in place for any incidents involving the virus. Rwandan health officials are also planning to coordinate with local officials in Goma to fight the spread of the virus. Rwanda has recorded 4 cases since the outbreak began in the region, with 2 now having recovered. There have been no fatalities. Residents of the Ngombo Island in Rusizi district have expressed gratitude for the planting of seeds and industrial-grade fertilizers that they have been given to use during the 2025A agricultural season. They are happy about the fact that the supplies have come on time this year, saying that previous delays have always had negative repercussions on their agricultural activities. They have also been provided with lime to counter the acidity of the soil to boost productivity. Other modern agricultural practices, such as the adoption of terraces as a way of fighting soil erosion, have also been helping to provide better yields for farmers. The supplies are being provided by the Tura project that has distributed as much as 2.5 tons of planting, seeds and fertilizers among 2,600 farmers on the island in Lake Kivu to be used on 1,460 acres of farmland. Moving on to health matters, Rwanda's health institutions report that approximately 1,000 people succumb to cancer each year. The Rwanda Biomedical Center, RBC, confirms that while essential resources for cancer treatment are currently available, certain types of cancer remain without specialized care due to a lack of experts in those areas. We have the report via Olivinetti.
Cancer treatment encompasses various approaches with 3 primary methods: surgery, radiation therapy, and chemotherapy. The choice of treatment depends on the type and stage of cancer, with some cases requiring a combination of all 3. Presently, all these treatment options are available in Rwanda. Specialized centers dedicated to cancer treatment in Rwanda include the Butaro Cancer Center of Excellence and the Rwanda Cancer Center, which is affiliated with the Rwanda Military Hospital. These centers focus exclusively on providing care for cancer patients. Colonel Dr. Pacifique Mugenzi, the head of the Rwanda Cancer Center at Rwanda Military Hospital, highlights that they have been providing cancer treatment for the past 4 years. He notes a positive change in the increasing number of people seeking treatment, attributing this to growing awareness efforts that are beginning to yield significant results.
There has been very obvious and considerable improvement over the years when it comes to cancer services in general, and we see this from policy makers to health professionals and even the population. So as far as we are concerned, I think part of that improvement has been marked by the availability of radiotherapy, a service that few years back used to be a reason for referral abroad. So now we are happy to report that we are able to provide that service in our cancer center since just over 4 years now.
Cancer treatment in Rwanda began in 2012, at a time when there was not a single Rwandan doctor specialized in this field. Today, there are 115 doctors in this field. Dr. Theonest Maniragaba, director of the cancer program at the Rwanda Biomedical Center, explains that cancer treatment services have significantly improved over the years, reflecting the country's growing capacity to address this critical health issue.
Ubu ngubu
In 2013, we had our first radiology oncologist, and the following years, the Ministry of Health implemented a system to send many doctors for specialization. Currently, the number of radiology oncologists and those providing chemotherapy has increased. However, cancer treatment involves more than just medication. It also requires accurate diagnosis. Previously, we did not have histopathologists, with the first one arriving between 2014 and 2015. For the past 12 years, the Butaro Cancer Center of Excellence was the only center offering cancer treatment, and it has continued to expand its services. Radiotherapy, which was officially inaugurated in 2020, was missing in Rwanda from 2012 to 2020. Statistics show that 60% of patients needing cancer treatment require radiotherapy.
In addition to specialized cancer centers, several general hospitals in Rwanda also offer both general healthcare services and cancer treatment. This includes the University Teaching Hospital of Kigali, which also has a particular focus on pediatric cancer treatment. Dr. Aimable Kanyamuhunga, a pediatric oncologist, notes that an increasing number of tools and medications are becoming available to effectively treat cancer patients.
The most challenging we had in the past, it was affordability and accessibility of cancer drugs. We had in the past surgery, have been operating patient with cancer and yet transferred to Taro for chemotherapy. That was story now. We have good surgeon, we have chemo drug for patient that can come at say Ashika in pediatric population. And whenever we need radiotherapy, we're still relying to RMH.
Despite the availability of essential cancer treatment services across Rwanda, a significant gap remains in that these services are not yet centralized in a single facility. Currently, radiotherapy is only available at the Rwanda Cancer Center at Rwanda Military Hospital, highlighting the need for further integration of services. As a result, all patients requiring radiotherapy in Rwanda must receive treatment at the Rwanda Cancer Center, which currently accommodates between 80 to 100 patients daily. Colonel Dr. Mugenzi Pacific, the head of the center, explains that as the facility continues to develop, they aim to expand their services and acquire additional equipment to better meet the growing demand.
We started with one form of radiotherapy, which roughly translated would be radiotherapy whereby a machine would deliver the dose without touching you. But there are additional techniques that are required, especially in some female cancers, which is called brachytherapy, which now is the type of treatment that the source is put in contact with the treatment area or the patient, so to speak. So I am happy to report that we are in the process of starting that service. The construction and the procurement of the equipment is almost, it's near completion. So it's an additional service that we are proud to be able to afford to our patients. So the other one in the near future involves nuclear medicine, which is also part of the missing link so far when it comes to cancer management, which is actually one of the few reasons why we still have to refer some patients abroad.
Currently, Rwanda's community-based health insurance covers 100% of surgery costs for patients in need. However, it only covers 90% of cancer treatment costs for patients requiring radiotherapy, leaving patients responsible for the remaining 10%. This copayment is considered a significant barrier due to the high cost of treatment. Dr. Theoneste Maniragaba, director of the cancer program at the Rwanda Biomedical Center, indicates that the Rwandan government is working on measures to ensure continued care for cancer patients and ease their financial burden.
We are collaborating with partners to explore options for reducing or eliminating the 10% core payment for radiotherapy, with the aim of easing the financial burden on cancer patients. Additionally, while chemotherapy is currently provided in Rwanda with the support of partners in health, the government, together with the Rwanda Social Security Board, is working on an agreement to include chemotherapy coverage In the cancer care package, we have initiated the necessary steps and are now focusing on implementation.
Despite the availability of basic cancer treatment services in Rwanda, some patients still seek treatment abroad for several reasons. One key factor is the need for a positron emission tomography, known as PET scan, an imaging test that provides detailed insights into the metabolic or biomedical function of tissues and organs. Additionally, patients may seek advanced care for more comprehensive diagnosis and treatment, as well as access to specialized expertise not currently available in Rwanda, such as hematology and transplantation for blood cancers. Experts in cancer treatment emphasize the importance of collaboration among all parties, namely patients, doctors, and the government, to effectively reduce cancer mortality rates. According to the World Health Organization, cancer causes over 9 million deaths worldwide each year. In Rwanda, cancer cases have been on the rise. From 2018 to 2019, the number of new patients increased from 3,270 to 4,984. Although there was a slight decrease to 4,850 in 2020, numbers have continued to climb since then, with 5,215 new cases in 2021 and 5,263 in 2022. Each year, approximately 1,000 people die from cancer in hospitals. Olive Nete, RTV News.
That VOA story marks the end of our bulletin, and on behalf of the news production team as well as the technical team, would like to thank you very much for sticking with us on RTV News. My name stays Martina Avera, and for now, stay safe and have a great night.